Now let's welcome Joe Hall, and he's the Transcultural Health Manager with Novant Health. That's a mouthful, Joe.
It is a mouthful, it is.
So welcome to our show today. I'm so glad to have you. I've missed seeing you around the hospital, but you have a great new job that you're going to tell us about.
I do, and thank you so much for having me.
Well, it's really my pleasure to have you here. So let's first start with your background.
Sure.
Let our viewers know where you've come from. Where did you grow up? Where did you go to school? That kind of thing.
Oh, wow. Okay, so I grew up here in the Wilmington area.
Nice.
All the way through from Carolina Beach Elementary, graduated from Hoggart High School. I have been a nurse now for 23 years. I can't believe 23 years has gone by so fast.
It goes by so fast, doesn't it?
It has. I have a master's degree in the science of nursing with an emphasis in education. Mm-hmm. And through that career, I have been allotted wonderful experiences from working from critical care to emergency medicine to leadership.
Yeah. Well, great. I'm really excited to learn about this new venture that you're on. So, just recently, you began serving as the Transcultural Health Manager. And I know you said to me one day, you get strange looks from people when you say that. So probably I was the first one. So just tell us a little bit about what that entails.
Well, I am one of the two Transcultural Health Managers here for the coastal region.
There's only two?
There's only two of us for the coastal region.
Oh.
So our Greater Charlotte and Winston-Salem markets has had this role for a couple of years now.
Okay.
And with the integration of Novant coming for the coastal region, they wanted to make sure that we had this role that was ready.
Yeah.
And as a Transcultural Health Manager, we work for the Office of Health Equity.
Okay.
Okay.
That makes sense.
So working for the Office of Health Equity, we like to look at things through our real gaps lens or our health equity lens. And we discover that there are gaps and disparities among communities and different cultures. So the Transcultural Health Manager is looking at the different types of cultures within our communities that we have and how can we get them the remarkable care? Where can we get them equitable health care?
Yeah, you say this is new for the region. So how do you start this program? Where does this all, how do you focus on that? Where does that?
When this was proposed and it was started here in our coastal region, we knew you had to get out there. You had to make the relationships.
Yeah.
You had to talk to folks who are interested. And with all the institutes that Novant Health has, there was always someone there. And we come to find out that most of our dyad leaders that we had or the institutes were already looking at health equity issues. They just didn't know what the word was or how can we do this. So we were able to go in there, make the relationships with them, look at what they had, not reinvent the wheel, and progress it, make it better than what they already had.
Well, I know a little bit about Novant Health's goals around mammography.
Yes.
And so how did that help here locally? What did we learn from that?
What we learned was looking with our health equity lens, we could notice that our patients from our Asian communities were not getting their mammograms. They were not, they were not receiving information. And we were wanting to know why. You know, that's the thing about the Office of Health Equity. That's one of our big questions is why. And so looking through our real gaps lens, trying to figure out what was happening, we realized that there was a cultural component. And looking at that cultural component, the Office of Health Equity and the Institute partners were able to develop best practices that gave the patient the time to disrobe in an area that was more secluded or limited the time for exposure to the provider while the mammogram was being completed.
Yeah.
And with this initiative that was started, we have seen a drastic increase and rise in our Asian communities that are getting their mammograms.
Really?
They're our highest communities right now that are receiving the mammograms versus any other population or community we have.
Really?
Yes, ma'am.
That's amazing.
It is.
So you started this process of collecting data from different areas on different cultures,
Yes.
so that you can come up with these best practices?
That is correct. What we do is the Office of Health Equity and the team, we look at strategies and we start looking at, like I said earlier, the whys. And looking at a real gaps lens, we're looking at race, ethnicity, language, gender, age, our payer sources,
Oh,
and
I never
things
thought about
from sexual orientation and gender identity.
Yeah.
And once you start utilizing that data, the data tells the story.
Yeah.
It'll tell you if it's headed in the right direction or have we hit a bump in the road. And if we hit a bump in the road, you take a step back and you say, hey, what have we missed? And that's the piece for health equity.
Well, I know we talk about health disparities a lot. And when we have these disparities, does it increase the risk or the complications or even maybe death because we have such disparities in the country?
Absolutely. Right now, the United States is facing one of our biggest crises that we have, Black maternal crisis.
Really?
We are looking at a 58-year high that a study has been completed that the African American and Black moms and babies are 3 to 4 times more likely to die before, during, or after child labor.
Wow.
Yes, ma'am. And with that, we looked at it and said, hey, what's going on? So we're looking at social determinants of health.
Right.
And some of the social determinants of health that we're looking at are good, nutritious foods. Are they able to get to their doctor's appointments?
Yeah.
Do they have the access to make the appointments? Also, discrimination and racism based upon bias.
Wow. So what are we doing to address all of these issues with this?
One of the most, I would say one of the positive initiatives that we have done in February of 2021, our community engagement team started and piloted a program. This program was placing doulas and community health educators together to go out and be part of this birthing experience.
Oh.
Okay, and so are you familiar what a doula is?
I was going to say, for our viewers, maybe we need to talk about
Absolutely.
what a doula is.
So a doula is someone who is trained to actually be part of the birthing process from beginning, during, and after. And with our community health educators, they're able to get together and say, okay, we're looking at pregnancy issues, pregnancy problems. How can we help guide our mothers along? And with this initiative, it was a 2-year federally granted funding that they were following 30 mothers within the New Hanover, Columbus, and our Pender counties.
Okay.
For 2 years, they followed them. With the utilization of the doulas and the community educators, we didn't lose any of our moms. We didn't lose any of our babies.
Wow.
That's the best part about that was the positive end to this. Now we're able to say, hey, this is something. Are we still working on it? Absolutely. We're still on a 58-year high of it. But now we can extend this out through our Novant fingerprint and get folks taken care of that are needing our help.
So that is a really great story. And I cannot believe how much progress we've made, and you didn't lose any women or any babies in a endangered group, so to speak. So I know that you've been a nurse for a long time, and I'm wondering how helpful is that nursing background in this cultural program that you're, this transcultural manager role that you're in?
Absolutely.
How does that nursing degree or that nursing experience, I would say, how does that help you?
All of our transcultural health managers for the Office of Health Equity have a clinical background.
Really? Okay.
With this clinical background, we're able to go in, we can look at physician or provider notes, we can look at nurses' notes, we can look at the processes and say, you know, maybe we're missing one key part. And that's where we get with our our best practices. It's almost like when you were younger in school, the scientific method.
Yes.
You always start with a hypothesis.
Yes.
I feel personally myself within the Office of Health Equity as a transcultural manager, I kind of look at that, I look at my hypothesis, and I want to ask 5 questions.
Okay.
Who, what, where, why, and how. And from there, you can start to see the gaps. You can start looking at the disparities. And once you see the world through a health equity lens or through a real gaps lens, your vision changes. And then you start to realize that the patient is a patient, and we treat them as a whole patient and not just a diagnosis.
Yeah. You're amazing to talk to. Where do you get your passion? You've always, as long as I've known you, you are a very passionate person.
I come from a family of, I made it.
Yeah.
I can say that. I made it. And
That's awesome.
a lot of my family's like, you've always made it. And that was, you never look at the underdog. You never look down on the underdog. You always want to know why. So.
Well, Joe, thank you so much for being here today. It's been wonderful chatting with you, but I have so many more questions. I hope you'll come back because this is a relatively new role, and I want to see where we're going.
Absolutely.
Where we've come from and how far along we are. So you'll come back?
I absolutely will,
Great.
and I would love to share more information.
Great. Well, you've been a great guest. Thank you so
for
much.
having me.